Hello, leaders of the world. Welcome to Spread Love in Organizations, a podcast for purpose-driven healthcare leaders striving to make life better around the world by leading their teams with genuine care, servant leadership, and love. I'm Naji, your host, joined today by Alicia Tozier, Senior Vice President of Global Market Access and Marketing for Outlook Therapeutics, a company specializing in ophthalmic products. Alicia has served as a global healthcare senior executive, leading teams across the full product lifecycle and 18 plus launches, spanning 8 plus therapeutic areas in 70 global markets via multiple innovative modalities, including medical devices, digital therapeutics, and pharmaceuticals. She is a purpose-driven leader, guided by integrity, values, and a deep focus on the patient, informed by her own experience as a caregiver. She holds a bachelor's degree from UC Santa Barbara and an MBA from Colorado State University, and is an alumnus of the Stanford Graduate School of Business Executive Program. Alicia, it's a pleasure to see you again and have you with me today.
The pleasure is mine, Naji. Thank you for having me.
Can you first share with us your personal story? What led you to healthcare and becoming now a senior executive in a biotech company?
Wow, great question. I would say healthcare is definitely where my passion lies. And I tend to be very purposeful, right, in terms of my desire to be in healthcare. I think one of the ways that you and I were actually first connected was in terms of my desire for being a purposeful leader. And I actually am able to participate in a nonprofit book that's being put together by a good friend, Jill Donahue. I have an excerpt I could actually read for you, Naji, if that makes sense.
Yes, perfect. We both got connected through Jill, so we're both fine.
We did. Indeed. So what I wrote was titled, "For Those of Us Struck by Lightning, a confession about what motivates me." It's 2 a.m. I'm at my child's bedside. He's asleep now. The seizure ended 3 minutes ago, but the fever that caused it rages on. His hand is resting on mine, bigger now than it was when I first held it, when they placed him on my chest at the hospital. But he's still my baby, my angel, and it kills me to see him this way. In 4 hours, I have a conference call, and 6, a presentation. This has been my life more times than I care to remember. For the last 8 years, ever since my son was diagnosed with a rare genetic disorder that, thankfully, he will grow out of. I don't want you to feel sorry for me. It's a small price to pay to have the privilege of having such a wonderful human being in my life. I tell this story because I want folks to understand, for me, that working in the rapidly advancing field of healthcare is not just a passion, it's personal. I have another confession to make. I hate when someone, especially a doctor, quotes statistics at me. I've had 2 different neurologists tell me that the chances of Ethan's symptoms being GEFS plus with no prior family history was less likely than being struck by lightning. Well, for those of us who have been struck by lightning, the fact that it's a rare occurrence is little comfort. Accordingly, every time I hear of a novel therapy or new indication for a previously existing product, especially one that treats a rare disease, I think of Ethan. I think of a parent sitting in a dark room at the bedside of a sick child, and remember how lonely a place 2 a.m. can be. We all got in this field for different reasons. We're all motivated by different things. But I wanted us all to take a moment to remind ourselves that we work in an industry that generates healthcare solutions for real people. And I, for one, couldn't think of a better use of my time. So that's really what I wrote, Naji, and I think it's my heart on a page. You know, it's truly important what we do.
Oh, thank you so much, Alicia, for sharing this part of your story. So can you take us a little bit back in time when you really started in the healthcare and how you shaped your purpose as you were going through and what you're doing today as a leader?
Yeah, absolutely. You know, as I started back in healthcare, I'd love to claim it was part of a grand plan. But it wasn't. You know, I saw healthcare as an opportunity to give back. And if I were to rewind back even before there in my life story, a lot of what has shaped me has to do with my upbringing. So I'm 3rd generation. my grandmother on my mother's side didn't actually speak English. And my grandfather was literally a hero in the war, and came back to the States and had 2 jobs, worked hard, was a small business owner, raised a family, and was an incredible role model for me growing up. And so I knew that leadership was going to be a part of what I wanted to do. And I knew that career and achievement could be tied in a noble way to giving back to others. And so for me, as I thought about my career early on in the early days, I knew that leadership was going to be a part of what I wanted to do. I knew that work ethic, another thing I learned from my grandfather's modeling, was something that I wanted to pull through in everything that I did. I started out in healthcare on the pharma side of the business. And I would say I earned my first role when I had no business even being in pharma. I had no experience, but I was passionate about diabetes at the time, interviewing for Sanofi Aventis. And, it ran in our family. So that was a passion of mine. And somehow or another, I convinced the interview team to hire me. And that was the way I started in pharma. And since then, translated across the device world, digital therapeutics. But when my son was born, and again, this was about 8 years ago, I think it really reinforced my desire to be in healthcare and really solidified what I wanted to accomplish.
So we hear it, I see it, but we hear the passion you have in your voice in healthcare throughout giving back, helping others very early on. And then what you shared with Ethan, your son, and how passionate you are to bring innovative therapies, even more for one single person who might be suffering in rare diseases, which is really noble. And I think it's great that we are seeing advances in gene therapy today and other domains that will hopefully help those patients. Can you share with me a little bit more how you would define your purpose? How do you define it personally? I always get this, because all of us in healthcare are here for a reason. We all have this strong purpose that we have, and we really want to do good and help patients live better. But frequently I get this question, how do you get to define your purpose as a person? And then how would you translate it to your teams on a daily basis? So I'd love to hear how you get to this point of defining yours, and then how do you do it with your teams to drive them constantly to bring innovations to patients?
Yeah. So great question. I guess I would say the beginning of my purpose, if I were to think of what drives me, is certainly my role as a caregiver and the experience that I've had, navigating, as a caregiver, a rare condition with my son, as well as other health conditions, right, that exist in the family. What I've pulled from that from a leadership perspective are a couple of things. You mentioned passion. So I think passion for the patient is front and center in everything that I do. When I think of how I translate that into teams and team dynamics and achieving goals, truly it's about reminding ourselves on a day-to-day basis that what we're doing at the end of the day impacts a patient, impacts a caregiver, impacts a family member. And I've been given, that gift of having a medicine truly impact and change our lives personally. So ways, just pragmatically that I pull that into what I do is just, ensuring that we bring patients in to our meetings, ensuring that we know as much as possible what the experience is like for patients. If it's vision, showing pictures of vision loss and the fact that the center of your vision is blurred. Oftentimes our meetings will begin with pictures like that. It can be small, tiny ways just to remind us that there's many noble professions and we have quite a big responsibility in healthcare that we have patients' lives at stake. The other part I'd say I learned and the gift I gained as a caregiver is just compassion. So it's important to put the patient first, but it can't be at the sacrifice of a team, right? So having compassion for team members is something that I try to bring through. And that can be in simple ways, right? I think that, we need to set audacious goals. We need to have accountability, both ourselves as well as our team members. But there's ways to do that with compassion, by checking in and saying, hey, what's getting in your way? What supports do you need? How can I help? And I think continuously doing that as a leader can model that for others to do the same.
And you've left the team, Alicia, in both big pharma, as you said. You started there, you moved to biotech, you've done med devices. I'm intrigued, is there a specific leadership trait or capability that you really relied on as you're doing those? Because you led also globally, large teams, smaller teams, but always with the same passion at the end of the day to bring innovation to patients. Was there something that you feel like a trait as a leader that you really all the time relied on during those different experiences?
Yeah, I would say a trait that has served me well is truly this concept that the best idea wins. And, whether it's leading large teams at a global level, US level, device or pharma, I would go back to my roots. And one of the things I learned as I observed my grandfather as a leader is that everybody's voice counts and the best ideas can come from anyone. So as I faced business challenges, what I try to do is just to ensure that I'm capturing the voice of many. When I scale teams, I purposely try to recruit talent that bring unique skill sets to the table and different experience sets, whether it's coming from a large company, coming from a different part of healthcare, but truly trying to arm a team with diversity of skill sets and experiences. And my kids, like many of us, love Disney. So if you've seen Ratatouille, it's like, anyone can cook, right? So in my mind, any idea, a great idea can come from everywhere. Everyone's not a great cook, perhaps, but that great idea can come from any pocket of the organization and from any level within the organization as well.
I love this. So we're going here into what we would call, as you know, like the idea, right? Like all this diversity, how you include, how you're equitable. And then we discussed, both of us, not in this podcast, but quite a bit about belonging. So I'd love to get your view once you're saying best idea wins, everybody's voice really counts and is important in the game. How do you do it practically as you're building teams? Can you give us some stories or maybe tips for us as leaders into how to ensure that it's not only hiring diverse people, but really making sure that the culture is built around including them, hearing their voices, and then building the sense of belonging?
Mm-hmm. Yeah. I think sense of belonging is absolutely critical. And I think anchoring down in terms of this best idea winning and truly hearing from different pockets of the organization. There's an example that comes to my mind, and this was, many moons ago. But I was, walking into a launch scenario. It was a couple years before launch, and it was like a perfect storm. We had a supply constraint over 50 markets we were launching in, and we had to start to prioritize which markets we were going to go to. So I see you smiling. These instances do happen. And as I walked into the situation, the initial concern was it's a supply constraint. So I immediately started saying, how do we solve the supply issue? Can we get high capacity lines? What could we do to solve this problem? And it turned out that wasn't actually the real problem. That wasn't the real challenge. And so that was a good learning. And I actually had to pivot myself. But the way I discovered this was by asking questions from folks beyond just, your typical leaders, general managers, et cetera. I started to talk to our different cross-functional partners. And it wasn't until I had a conversation with an IT gentleman who was building the platform and really having a conversation and seeking his input and perspective that I realized that the actual issue was translation hurdles and the fact that we had prioritized markets based upon which languages we would have available. So you had markets like Estonia launching before Germany. So obviously, this created a dilemma. We went back, we restructured our launch sequencing, we aligned it to our strategy, business objectives, what patients needed in those markets. And we actually chose to exit certain markets and differentiate different product offerings based upon that. So it was a big sort of reboot. But where I go back to is just that conversation I had with somebody who wasn't the typical person sitting on the leadership committee. And I think the learning I took away from that, and I try to bring through within teams, is that everybody's voice counts. The great idea, the great aha can come from anyone. It doesn't matter if it's the IT person, the HR person, the janitor, or the CEO, right?
I love this example. And yeah, we're faced with these examples. And what you said is so critical, right? When you have a big problem, try to go see and assess, right? And really listen to people who operationally are trying to fix it. It's such a great example you're giving. Thank you for that. I'm going to now give you a word, and I would love your reaction to it.
Okay.
So the first word is leadership.
Well, my first reaction, I'd say, is it's tough and it's a lifelong journey. And the reason that I say that is because I think all of us leaders that strive to be the best versions of ourselves that we can possibly be requires constant desire to adapt, to change, to grow. And I would say for myself in particular, that's certainly been the case. I've had plenty of bumps and bruises along the ways, learnings that I've pulled forward. I don't think I'll ever get to a point where I'll have life licked and I'm like, all right, I got it. I think there's always this desire to learn a bit more. And I had the good, I was grateful to go through a recent leadership program, even as of this last year. So it's like you get your MBA, but you can get to a point where you're like, you know what? There's new things to learn. And I was surrounded by 70 other leaders who were very accomplished in their career, clearly very smart, and yet they chose to be there. They didn't have to be there. They wanted to be there. And that was such a perfect gift for me that I'm really grateful for, to just remember that leadership is about constantly wanting to learn and grow.
I love it. We're constantly work in progress, obviously, as leaders.
Yeah.
But you need to have the humility that you're demonstrating once again to say, like, I still have a lot to learn, right? I think this is part of the traits you're bringing in this discussion. So if I want to double down on this one, is there anything that you wished you knew as leader like 10 years ago or 15 years ago when you started to lead teams and manage teams?
Yeah. You know what I would pull is a Mr. Rogers quote. My kids will also watch a show called Daniel Tiger, and one of the phrases is, "It's okay to make mistakes, try to fix them, and learn from them too." And I think early on, when we're all go-getters and we're trying to build our career and show the world what we can do, it can feel like you can't make mistakes. But failing forward is actually one of the best qualities I think a leader can have. We all stumble, and I think it's all about acknowledging the mistakes, learning, and growing from it.
The next word is purpose.
Purpose. I would say beating heart. It's, for me, the beating heart of what I do. And we shared in the beginning of the conversation some more specificity as to why. My son has taught me so much. And, I was interested in healthcare, certainly before, we had Ethan, but it has only become more solidified. And my purpose is truly, for me personally, my beating heart. It's why I really like doing what I'm doing. And I just expand upon that story a bit further and share that even today, we're experiencing challenges in our journey. It's still an ongoing journey. We're trying to get access to medicine. And so as a leader, I oversee marketing, market access. And what I do every day is think about how we can get access to therapies for patients. And yet on a daily basis, even as of this week, I'm trying to get approval for this unique medication for my son. So purpose to me is the beating heart because it's so intertwined with what I do, I can't even separate it.
You bring up access, and it's certainly, it's one of those problems we're facing and globally and in the US. It's just mind-puzzling in a country like the US having issues with access or worrying of getting a drug approved for patients who need it. But it shows that we have still a lot of work to do as healthcare leaders.
Yeah, and we've made great progress. I would just acknowledge that. I think we are on the path to providing more options. There's rare diseases that are being studied and evaluated with models that can allow for access. So I would say, yeah, Is there opportunities? Absolutely. Are we on a great path? Yes. And that's part of what I want to contribute towards.
Well, we're lucky to have people and leaders like you striving every day to make that happen. So thanks for sharing this, Alicia. The third word is lightning.
Well, I literally had lightning as part of the title of my excerpt. And I would say what I think of when I hear that word is the first seizure that Ethan ever had. And it's part of the humility, back to the comment around learning. And a trait that I have found to be really meaningful as a leader is, the first seizure that occurred, we were literally struck by lightning. We never thought something like that would happen. We didn't do everything right. We did the best that we could, but then we rapidly learned after that. And I think all of us face different situations in our lives where we're caught flat-footed. Sometimes we're knocked to the ground, and it's all about how we get up, and it's all about how we learn and how we take that forward.
Well, this is so powerful and inspiring, what you're sharing. Can I ask a question around, also you shared your caregiver, your mom, you're an executive, you've been super successful as a leader in healthcare and beyond, I would say, with the influence you have on the systems. You're a student too now again. You're really such a great role model for many who sometimes don't feel they can do all this. So I'd love to go there, and if you can share in advice, how do you do it? How you would encourage others to try to do things? I'd love your take on this.
Well, that's a great question. And Naji, if you ever get the recipe, I would want to hear it and see it. I would claim that I don't have the perfect recipe. So to answer your question directly, how do I accomplish that? Imperfectly. And I think it comes back to grace. We talked a lot about compassion for teams, but oftentimes I think one of the biggest tasks we can all face is having self-compassion and giving ourselves grace that we're doing the best that we can. It sounds very simple, but is not always easy in application. So I would just acknowledge that first and foremost. The other piece that I would just share is that I have an amazing spouse. I met my husband in high school. So I was high school sweethearts. We've lived our lives together. He is a full-time dad. And so in terms of managing everything at home, things have ebbed and flowed, but I am incredibly grateful to have him, fully focused on our children, our family, being an incredible partner. So I think that that's given me basically the ability to do what I do. I think he's Superman. The other part I would just share is, mindfulness. It's funny, in all the things that you just listed off, I do carve out time just to be mindful. And that's sometimes the biggest challenge. I mean, when we wake up in the morning, each of us are wired different ways. It takes different things to help us show up in the best version of ourselves. But, I have my own routine that I go through in the morning. And it helps me be mindful and stay healthy.
Thank you for sharing this. The last word is spread love in organizations.
Number one, I agree that that's important. I think it's incredible that you're doing this podcast, Naji, and I'll just say that right now. The more we can be learning from each other, the better. When I think of the phrase spread love, what I think about is bringing passion and compassion. And that's the gift that I've been given as a caregiver to bring forth to everything I do, whether it's at home or at work. But when I hear spread love, I think of how can you bring passion to what you do, whether it's a love for your community within work, whether it's the passion for what you're going to accomplish through all of your efforts. And then compassion is just giving people grace. I mean, we all have things going on in our lives. And I think the more that we can try to learn from one another, the more we can check in and ask, how are things going? What support do you need and how can I help? I think the better.
Any final word of wisdom for healthcare leaders around the world?
You know, I'm struck by what you're doing with this podcast, Naji, and I'm so glad that you are. I'm inspired by the sharing of stories. I think my story is one that could be helpful, but I know there are many. And so I would just put a call out there to share your story however you can, because I think we all can learn from one another. We talked about this earlier, and anyone can cook. Great ideas can come from everywhere. And I think you can learn something from everybody. So I think the more that we're able to share our journeys with one another, the better. And I think just staying open and curious to learn and grow.
Well, thank you so much, Alicia, for your words. I certainly learned a lot from you. What an incredible chat. Thanks for your generosity, vulnerability, and exceptional leadership that you demonstrated today. So it's been a real pleasure and honor to have you. Thanks again for being with me.
The pleasure's all mine, Naji. Thank you for having me.
Thank you all for listening to Spread Love in Organizations podcast. Subscribe and connect with us on SpreadLoveIO.com or wherever you listen to podcasts. Most importantly, spread love in your organizations and spread the word around you to inspire others and amplify this movement our world so desperately needs.